Casquex, good morning. My name is Dr. Michael Trahan. I'm a psychologist and the director of the Behavioral Health Program at the Standing Rock Service Unit here in Fort Yates, North Dakota. I am talking today about our behavioral health services and what we're doing during this pandemic. What we're doing with behavioral health is we are conducting regular therapy sessions over the phone with our regular clients, but also if we have new clients that are coming in or would like to start services, we can also conduct intakes over the phone. All you'd have to do is just call our behavioral health department in Fort Yates at 701-854-8227 and request an appointment. Generally, our intakes take approximately 45 to 60 minutes. We will get verbal consent over the phone from the legal guardian, or if the person is over 18, they can provide informed consent for themselves for treatment. And then we can conduct the telephone call. As far as for our telehealth patients who receive psychiatric medication from the Avera program, if they are existing patients already, Avera has received permission to contact individuals on either their cell phone or their home phone to provide follow-up services and refills on prescription medication. For new patients for the telehealth program, Avera requests that the patients will show to the clinics as usual, and the intake will be done over the telehealth system for Avera. After that initial appointment, the patient can request the phone calls for the check-ins, and they would just need to call the Standing Rock Service Unit pharmacies at Fort Yates or at McLaughlin for refills. And now for some parenting guidelines for parents with their children at home now. I introduce Dr. Kelly Reiner, a psychologist at our Fort Yates clinic.
Hi, I'm Dr. Kelly Reiner, and I just wanted to talk a little bit about just kind of how we can take care of ourselves during this time. I wanted to just remind everybody that it's normal to feel stressed, sad, confused, angry, scared, or even just tired during a time of crisis or uncertainty. But we have some tips that can be helpful for us and how to talk to our kids about how to cope with stress during this time. For ourselves, one of the things that we might want to do is just talk to those that are our supports. So talking to those that we trust, staying connected to family and friends by phone, email, or other forms of technology. We also want to keep in mind that it's important to maintain healthy lifestyle, such as maintaining or starting healthy eating habits, also having healthy sleeping habits, making sure we're going to bed, getting adequate sleep, trying to get some exercise when possible, and also making sure that we're drinking water. I know those things kind of sound pretty basic, but they're really important to maintaining our overall well-being, especially during a time of stress. We also want to avoid using drugs or alcohol, even smoking or caffeine, as a way to cope with our emotions. It can be tempting to do that when we're stressed, but they can lead to other problems or making us more vulnerable to feeling overwhelmed. Along those lines, we also want to be careful about the amount of time that we're spending on social media or other media outlets. It can be addictive to kind of scroll through social media and see what's going on and what are the new numbers and what's happening. But especially if it's something that can increase our worry or cause agitation, we want to be thoughtful about how we're spending that time and maybe consider limiting the amount of time that we're spending on social media or the news, or even having a day or a certain time to unplug. Part of that as well is learning how to pace ourselves and build in ways to relax throughout the day, ways to relax your mind and body, whether that's stepping outside, taking some deep breaths. We don't need a lot of time or equipment to learn how to relax during the day. And one way that we can do that is just maybe thinking about times that we've dealt with stress in the past and what was helpful, and thinking of ways that can we incorporate those things into our times right now. So I want to switch gears a little bit and talk about how to help our kids cope with stress. We want to keep in mind that kids can respond to stress in a lot of different ways. And a lot of that can be pretty normal, but it might depend on their age. So younger kids, you might see them acting in a way where they're maybe a little bit more clingy, maybe agitated, anxious, or withdrawn, or maybe even returning to previous behaviors that they've already outgrown, like bedwetting. And that can be typical during times of stress. We also want to keep in mind that kids learn and they process things through play. So it would be pretty normal to see them when they're playing, engaging in maybe rescues, or if there's an emergency, or they're a superhero, or things where maybe they're trying to gain control, or in their play, things are a lot of out of control. And that's just a way that they're kind of working through what's going on around them. In older children, maybe they're talking about the virus a lot, or maybe they're talking about missing their friends and not being at school. Or some kids may completely want to avoid the topic and not talk about it at all. In preteens or in teenagers, you may notice that maybe they're having difficulty concentrating, not really focused on doing their work at home. Some might be anxious and avoiding wanting to go anywhere, even if it's outside. And some may be acting out, so maybe getting into a little bit of trouble or arguing with friends and families. And again, all of these can be typical ways that kids are responding to stress. So how we can help them is responding to them in a supportive way, maybe listening to their concerns, providing some reassurance, and giving maybe just a little bit of extra love and attention. As much as possible, it could be helpful to keep with a regular routine or schedule. And I know this can be a challenge with school being out, or people working from home, or maybe not working right now. But if we can kind of keep up with our normal schedules, at least in the evenings or the weekends, including bedtimes, it can be helpful in creating a sense of safety and security for our kids. If our previous schedules don't work at all, it's okay to create new schedules and new routines that work for the family. I'm also a big advocate in talking to our kids honestly about things that are going on. So it's okay to talk to them about what's happening in the community, in the world around them, but we want to do it in a way that's clear and simple and age appropriate. Part of that can be teaching them about how to reduce the risk of possibly spreading the virus, such as hand hygiene, washing for 20 seconds, and talking to them about what social distancing means and what that can look like for them, maybe even the reasons for social distancing. And it's also okay to share your emotions with them. And what that might look like would be, talking to them about feeling sad yourself that maybe a birthday party has been canceled, or missing friends and family, and missing the opportunity to visit people maybe like you used to, or even letting them know that at times you feel worried too. And it's also okay if you don't have the answers to some of their questions. And again, it's just having that honest conversation with them about, I don't really know the answer to that, but that's why we're listening to the doctors. That's why we're listening to the tribe, and doing what they're asking us to do to help keep our community safe. And lastly, I just wanted to remind that we can help teach kids good ways to cope with stress, and ways to maybe provide some healthy distraction to help them feel better when they're feeling overwhelmed. So we may want to encourage them to do activities like drawing, listening to music, playing outside when it's safe, talking to a friend or a family member, maybe dancing, engaging in cultural, spiritual practices, crafting, things like that. And learning these skills is so important for them throughout their life. And it's a good time to try to teach these skills now. And it's also a reminder for us as adults to take care of ourselves during times of stress. And these are important things that can help us navigate this time.
Thank you, Dr. Reiner, for that great information, and a reminder that Dr. Reiner is a psychologist based out of our Fort Yates clinic. She's a great addition, and we're very glad to have her with us. She was talking in her segment about sharing things with children, the breathing techniques, and things that we typically teach people is with relaxation breathing is to breathe in through your nose. And so what we teach people usually is to breathe in through their nose to the count of 3. When you count, it's important to maybe use Mississippi or 1,000, whatever you want to use, so that you're not counting quickly, because typically when we're trying to use these techniques, we're feeling anxious and our breathing is a lot faster at the point. So you breathe in through your nose, pause, 1,001, 1,002, 1,003, and then exhale through your mouth, 1001, 1002, 1003. You don't have to say it out loud to yourself, but at least say it in your mind so that you can keep that nice even rhythm. Another thing that we teach people are what we call grounding techniques. And grounding techniques just help us get back into the moment. Usually with anxiety or things of that nature, we're thinking about the future, or we're thinking about different worries that we have. So these grounding techniques just help us get back to the moment that we're in and help us to relax. So how to do grounding techniques is to utilize the breathing techniques that I just talked about, but also using your other senses to kind of gauge what's around you. So like it's called a 5-4-3-2-1 technique. So as you're doing the deep breaths, you can think, what are 5 things that I can see around me? And then as you exhale, you can think, what are 4 things that I can feel as far as touch? So concentrating on maybe your feet contacting the floor, the back of your legs contacting your chair, and so on. You can do a body scan up and down if that's what you'd like to do and that's relaxing for you. The next one, the third part is what are 3 things that I can hear? It helps us practice being in that moment, and it can be anything from a fan to dogs out in the outside, or children, or whatever it might be. Just 3 things that you can hear. Also, maybe what are 2 things I can smell? Again, it's just part of bringing us back into that moment so that we're not too far ahead or too far behind ourselves. And lastly, what is 1 thing I can taste? Usually it's probably the last thing you ate, or if you had gum or something like that, but it helps us get back into this moment. Some other things that we can do or that take our mind off is utilizing different parts of our brain. A lot of times when we're activated, it's the middle part of our brain, which we typically call the alligator brain, or I call it that. And that's where our emotional center is. So if we can shift it to our frontal lobe, which helps us in decision making and processing things, it can help calm us down as well. So things that you can do, again, looking at the different things that you can see, maybe counting backwards from 100 by 7s, so like 100, 93, that's as far as I'm going to go, because I might not get the next one. Maybe spelling your name frontwards, backwards, maybe even doing simple math problems. Sometimes that's helpful if you enjoy math. Doing some things as far as making doodles or drawing, or things that Dr. Reiner mentioned before in that last segment. So these are things that we can all do to try to get us back and reduce some anxiety. We're not looking to get it down to complete 0, but if let's say that you're feeling, you rate it at an 8, as far as what you're feeling is anxiousness, and you can get it down to a 6, that's progress. That's what we want to see. Typically people want the absence of some of the uncomfortable feelings in order to feel better, but really what we're doing is trying to reduce the intensity of that emotion. So just following those guidelines, and again, if you have any questions about those things, we'll be happy to answer that. You can call us at 701-854-8227, and Jamie can direct your call to either one of us who can answer questions, or if you would like a telephone therapy session or intake, we can provide that all for you. Thank you.
All right, thanks, Dr. Trahan. Like he was saying, there's different ways to practice deep breathing, but sometimes, like he mentioned, it can be hard to remember how to do these things, or am I doing it the right way? So one quick, easy one that I like for kids, and actually I like it for adults, is because it's easy to remember, is maybe a 5 breathing exercise. You can use your hand, or you can think about a star. And what you're going to do is we're going to trace our fingers, and as we go up and down each finger, it's going to represent 1 breath in through the nose, like Dr. Trahan said, and 1 breath out through our mouth. So you can kind of go it through 1 time. If you're still not feeling relaxed, you can go it again and do 2 hands, or you can stick to 1 hand and do it again. So again, it would just be, as you trace up, 1 hand, 1 finger breath through your nose, and then out through your mouth. In through your nose, out through your mouth, in through your nose, out through your mouth, And as you're doing those breaths, you want to keep in mind that you kind of want it to be a deep breath, kind of down from more of your stomach rather than shallow chest breathing. But it's not a perfect way. And again, if it doesn't seem to be working, you can try it again. You can use both hands, or you can have a kid draw a star and think of other ways that might make it fun for them to engage in some of these deep breathing activities. Thank you.
Good morning, everybody, and welcome back to our second session. You just heard Dr. Trayan and Dr. Reiner from our behavioral health departments. We have a few questions that we're going to answer. I'll answer a couple of the questions. Dr. Tincher, our clinical director, will also answer a couple of questions, and Letitia from PRC will answer questions for you today. The first question I'm going to answer is, what precautions are you taking for the safety of your workers? To answer that question, we are taking many precautions, and we have been for the last couple of weeks here at the Standing Rock Service Unit. We have been cleaning our facility, doing deep cleaning in every department. Each department is doing their own cleaning every 2 hours, and we are screening staff before they come into the facility. And we explained that a little bit last week. So we are taking a lot of precautions for our staff to help them be safe. Everybody wears the PPEs throughout the facility to stop the spread amongst ourselves. We are also deep cleaning patient care areas and screening patients that have symptoms and bringing them in through another door, and having them go to the respiratory clinic to be tested if necessary. The next question, I'll answer two questions at the same time. There are two questions. Are all staff essential, and which workers would be sent home to stop the spread? Yes, at this point, all staff are considered essential because we are a hospital, and we haven't had any positive cases here in our area, and we haven't tested any positive cases. So at this point, we are all essential. All the moving parts have to work to continue the work at this hospital. There are some staff that will be sent home at some point if we start testing positive, to keep our staff safe and to limit the number of staff that are at our facility. All those staff that are telework eligible, that are able to work at home and have the equipment necessary to work at home, will be asked to do telework. In order to do that, the expectation, they would have to fill out a telework agreement and have the telework training. And all staff that do work from home have the same expectations for work that they would be providing here at the facility. They would still have to have, we would still monitor productivity for teleworkers at home. IHS telework eligible staff will be required to fill out the agreement, as I said. We are currently developing a plan for our facility on determining who is eligible and who could possibly be working at home. We're working out schedules with the department supervisors. We might have to alternate staff. Some staff will come in for a while, for work a couple days, and then work from home a couple days. We're looking at alternating schedules for those staff that are telework eligible. Direct patient care staff are not telework eligible. Nurses, providers, and those staff that have to be at the facility to provide direct patient care, they are not telework eligible. The next person that's going to answer questions is Letitia. She is our PRC supervisor, so she'll be answering the next two questions.
Okay, the first question for PRC is IHS still referring patients to Bismarck for non-emergency procedures? We are still referring and processing referrals as usual. Some of the vendors have started to cancel non-elective procedures, such as St. A's and Sanford, but they are still reviewing those and we are still processing them as normal. Next question I have is IHS considering sending more referrals to Mobridge or Aberdeen instead of Bismarck to avoid COVID-19? We haven't noticed any more than usual being sent to Mobridge or Aberdeen, since they are one of the vendors that have limited some of their departments. So I think that's more up to the provider and the patient on what their preference is. So still business as usual for that.
My first question that I received is IHS capable of administering any treatment drugs for COVID-19? So right now, there are no FDA approved drugs for the treatment of coronavirus. Currently, what we're doing is just clinical management, which involves oxygen as needed for these patients. We can do some breathing treatments under specific conditions. And then, if needed, mechanical ventilation with a ventilator. And it's kind of just watchful waiting at that point. You guys have probably heard in the news medications such as hydroxychloroquine and azithromycin. Those ones are, so like hydroxychloroquine and chloroquine are made they're anti-malarial drugs. There's hundreds of studies going on right now looking at the indication of these drugs with the treatment of coronavirus. So those are in progress right now. There are some places that are using them, and they're seeing some promise with the azithromycin and the hydroxychloroquine combination. Hydroxychloroquine is also a drug used to treat lupus and rheumatoid arthritis, so it might be a medication that some of you recognize. We're not just prescribing that medication to anybody for prevention of this or home treatment at this time. They're kind of reserving all of the excess hydroxychloroquine for those high-risk patients and those patients that are hospitalized. There's another medication called remdesivir that is an antiviral that they're also doing a lot of studies on. So I mean, that's kind of it's a difficult question because number one, there isn't really a treatment, but a lot of these experimental medications are in their early phases. Next question, how many ventilators are available to IHS? At our facility here in Standing Rock, we have 1 ventilator. My next question, what are the next steps for potential of COVID entering 48's IHS? So if we had a positive patient, we would work with the Department of Health. They would help track this patient and their family members as far as getting more people tested and home quarantined. Our governor yesterday stated that anybody who is positive for coronavirus, if they're stable enough to go home, they need to go home and quarantine for 14 days, as well as their entire family has to quarantine for 14 days. If they were to decompensate or need additional care, we would bring them in. As long as these patients aren't high acuity, meaning they don't need ventilation, we could keep them at our facility and monitor. We can do the nasal cannula oxygen and keep them here. If they started to decompensate, at that point we would talk with Bismarck about getting them transferred. My next question, next page. What are things workers who are in direct contact with the public can do to stop the potential spread to their families after their shift is done? So I've been hearing this question a lot. I've been seeing things on social media where a lot of physicians and nurses or anybody that works in the hospital, they go home, and I've heard of people undressing in their garage and throwing everything immediately into their washer, or as soon as they get home, and then showering. Some people keep their shoes out in their garage just because, we're in a higher risk environment working in a hospital. And so we just try to leave that any potential infectious, like our clothes or our shoes, we try to leave that outside of our home and then wash off right away. There are some places too where employees are nervous to be around their family because they work in those high risk environments. So I've heard of some people finding separate quarters, like keeping their family on one side of the house and they're on the other side of the house. Obviously, wiping your surfaces down to minimize that risk of exposure is also very important. And I think that's all I have for my questions. Thank you.
Okay, I'm gonna make one more comment here before I close out this session. CDC has now issued new guidance on cloth face masks. On Friday, CDC recommended wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies, especially in areas of significant community-based transmission. The medical grade mask should be preserved for healthcare workers and other first responders. This recommendation complements and does not replace the President's coronavirus guidelines for America, 30 days to slow the spread. I just wanted to give that information out there that there is guidance from CDC to wearing cloth face coverings when out in public. And with that, this will end our session for this week. We look forward to answering your questions on next week, and have a good week and please be safe. Thank you.